also giving the evidence that relationship building skills make a difference to the outcome of the consultation, not just for patients and their families, but the doctor too. And you know, there's a wonderful study which was done 25 years ago, I should think now, by Wendy Levinson and her colleagues, which shows that actually if doctors communicate well, they're much less likely to burn out or leave the profession early. So I'm sure you're all getting used to consulting by digital means. Certainly here, all calls to the doctor, the general practitioner, are triaged. And most of the work is actually done on the telephone. And I wonder now whether we will ever change and go completely back to seeing every patient. I don't think so. I have a very large family, and a few weeks ago, we had a concert on Zoom. Nieces and nephews from Vietnam, Australia, Spain, and the US got together with all the UK members, and we had a fantastic hour and a half with music, poetry reading, ballet, and most important, telling jokes. I regularly FaceTime with my husband, my children and grandchildren and friends. The children seem to have no problem about being themselves on camera. But I think consulting by video is fraught with problems if it's about anything that's truly important. I mean, if a patient is crying or depressed or not coping, I think it is hard because you've lost you can't use the sense of touch. And actually, it is quite difficult to convey a real sense of caring and empathy through your non-verbal communication skills. So I think I'm going to finish now and say thank you to everybody for bringing me out of retirement and giving me the opportunity to think about these very important issues. And I greatly look forward to listening to our other contributors. In the meantime, I would like to recommend the book, Clinical Communication in Medicine, to you all as a reference book. It's a follow-on from our book, and it gives very good historical perspectives. And it also covers issues such as communicating with colleagues, a very, very important topic, which I know we're going to hear about. So I would say, may we all keep our humanity as doctors working in these difficult times. So I would like to say, Shukran li isga ikali.